This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the Department of Neurosurgery at University Hospital Tübingen, published in Acta Neurochirurgica in 2026. The paper is titled OpenOR, a virtual reality framework for medical education.
It's a timely piece, Alara. We've seen a significant shift lately from those non-immersive, screen-based simulations to fully immersive experiences using head-mounted displays. For a field like ours, neurosurgery, the demands on spatial cognition and anatomical precision are just incredibly high.
Exactly. The authors, Grimm et al., highlight that many structures central to our decision-making, like neurovascular relationships or deep-seated lesions, are notoriously difficult to conceptualize using static atlases or conventional two-dimensional images. That's where their new framework, OpenOR, comes in.
Right. Now, for the residents and students listening, let's break down what OpenOR actually is. It's not just a simple 3D viewer. It's a comprehensive VR application developed in Unity. What stood out to you regarding the hardware and interface, Alara?
One of the key points the study makes is the move toward high-performance, consumer-grade VR hardware. This makes the simulation much more accessible and scalable than the specialized million-dollar setups of the past. But the real hook is the interaction. They've implemented hand tracking, which allows for intuitive and natural engagement. You aren't fumbling with buttons, you're using your hands.
Which is vital because it reduces the need for extensive familiarization. If I'm teaching a resident about the skull base, I don't want to spend 20 minutes teaching them how to use a controller. I want them looking at the anatomy.
Precisely. And the framework supports complete clinical case studies. It's a full pipeline. You have the medical history, a virtual DICOM viewer for PACS viewing, and then the actual 3D visualization. These models aren't just generic illustrations. They are MRI-based reconstructions of patient-specific anatomy.
That's a crucial distinction. They're using MRI segmentations to show pathologies and anatomical structures, but they've also integrated CAD, computer-aided design, models of real implants. We're talking about actual VP shunts and aneurysm clips.
It really bridges the gap between looking at a scan and being in the OR. They even included the original 3D surgical videos for each case, so a student can look at the 3D MRI model, then look at the CAD model of the clip, and then watch the actual 3D video of that clip being applied.
It's that integrated learning experience that the paper emphasizes. But let's talk about the multi-user aspect. In our world, surgery is a team sport. How does OpenOR handle collaboration?
This was one of the highlights of their results. OpenOR supports multi-user interaction with customizable avatars. This allows for collaborative learning environments where a mentor and several students can explore the same virtual space simultaneously. The study noted that this multi-user mode fostered collaborative learning and allowed for a playful approach to complex clinical problem-solving.
I like that phrase, a playful approach. It takes away the ethical and safety pressures of the actual clinical setting. You can make your first experiences in a risk-free environment. Now, let's get into the data. They conducted a usability test, right?
They did. They ran a pilot implementation with 30 medical students using structured questionnaires. The feedback was overwhelmingly positive. Students reported a perceived improvement in understanding of anatomy and surgical workflows.
And specifically for neurosurgery, the paper mentions that this is particularly effective for anatomically challenging regions such as the skull base and vascular pathologies. Those are exactly the areas where 2D imaging often fails to give a junior resident the full picture of the surgical corridor.
Right. The paper notes that immersive visualization enhances spatial awareness and surgeon confidence when planning these complex cases. The students felt that the combination of virtual PACS viewing and interactive 3D models provided a realistic and high-fidelity learning experience.
Let's dive a bit deeper into the technical side for our more tech-savvy listeners. They mentioned real-time rendering of highly detailed 3D models with complex geometries. That's a major hurdle in VR. If the frame rate drops or the resolution is poor, the immersion is broken.
Exactly. By using Unity and modern HMDs, they've achieved high-resolution rendering that supports the complex spatial relationships of neuroanatomical structures. The paper argues that this is a significant advancement in VR-based medical education because it offers a practical and scalable training solution.
I also noticed they mentioned the framework's potential for preoperative planning and case discussion. It's not just for students. Even for us attendings, being able to visualize the lesion extent and vascular anatomy in a patient-specific immersive model can support the development of operative strategies.
It's about interdisciplinary communication, too. The paper mentions using these models to support interdisciplinary communication and case discussions. Imagine a tumor board where everyone is looking at the same immersive 3D reconstruction, rather than trying to interpolate a series of 2D slices.
It really changes the conversation. So, Alara, looking at the conclusion of the paper, what's the take-home for our audience?
The authors conclude that OpenOR represents a significant advancement. By integrating immersive technologies with affordable hardware, they've created a system that enhances knowledge acquisition and procedural skills. The high user satisfaction and the confirmation of the platform's value for neurosurgical training suggest that this is the direction we're heading.
It's a shift from learning by doing on a patient to learning by doing in a high-fidelity virtual space. It addresses the high demands of our specialty: spatial cognition, anatomical precision, and the interpretation of complex imaging, without the logistical or safety issues of the OR.
And the fact that it uses 3D MRI-based models complemented by CAD models of real implants makes it incredibly grounded in actual clinical practice. It's not a toy, it's a framework for professional development.
Well, that's a perfect place to wrap up. A big thank you to the team at Tübingen for their work on OpenOR. It's exciting to see how these immersive environments will continue to evolve.
Absolutely. Thank you for joining us today on the Neurosurgery Hub podcast.
We'll see you in the next episode. Stay sharp.